You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Kaylee Delishmitt, BHC Manager of Wellbeing Strategy and Member Services.
Hello, I'm Kaylee Delishmitt, and welcome back to the BHC's Be Health Connected podcast. In today's episode, we sit down with the new president and CEO of the St. Louis Area Business Health Coalition, Laurel Pickering. Laurel comes to the BHC with over 20 years of coalition experience and more recently worked for Centivo, focusing her efforts on healthcare and technology innovation to improve health outcomes and affordability. Laurel started with the BHC in early June and has already begun to make her mark by engaging with our members and laying the groundwork for exciting new initiatives. Today, we'll be discussing her vision for the future of the BHC, her plans to build on the strong foundation we've established, and how she intends to continue serving our member companies with innovative and effective health and wellness strategies. So, Laurel, thanks so much for joining us and welcome to the podcast.
Thanks, Kaylee.
So if it's okay with you, I think it'd be fun to start off with a couple of get to know you questions. So can you tell our members a little bit about yourself?
Yeah, so I grew up in the New York, New Jersey area, and I have a graduate degree in public health, just like you do. And shortly after I graduated from public health school, I went to the New York Business Group on Health, which is the business coalition in New York City. And, it was really the first time that I learned about employers' role in healthcare. The idea that you could use the leverage of employers as purchasers of healthcare to drive change in the system, really blew my mind at the time. I had no idea. We didn't learn about that in public health school. And it's really what I've based my entire career on. I went to health school like many, wanting to change the world. And maybe you had that feeling as well, and make it better for those less fortunate. And when I learned that employers can push the system to make it change, and in most cases, when they do that, it changes for everybody, right? It doesn't just change for the employees of Boeing. It doesn't just change for the employees of Panera. It changes for everybody. And I was instantly hooked. This is the path to change and make things better. So I stayed there in New York at the coalition for 24 years. I worked with large national and global employers in New York, plus the city of New York, which is one of the largest public employers in the country. I focus mostly on quality and value, really educating employers to push the health plans to do better, to push the providers to do better. I stayed there for 24 years, so I clearly loved it. But then I felt like I needed to learn more. I also needed to see what the for-profit world was like. So I went to a digital health company, WellDoc, focused on chronic care management using technology, and then to an innovative health plan called Centivo, which you mentioned at the beginning. I learned a lot at both places, and mostly what I learned is that for healthcare to change, an employer needs to buy differently, and that's incredibly hard to do. It's hard for them to do. It's hard for those of us that want them to change to get them to do it. But an employer ultimately has to buy differently if we're going to change the system. But my roots were calling me back, and I learned about this opportunity, and and here I am, back running a coalition. I'm coming from Orlando. I have twin 19-year-old boys. One is in school for computer science, and one is about to embark on getting his graduate degree in public health, like you and me. So that's kind of cool.
It is cool. And it's kind of funny. You come from Orlando, but I've heard you say recently, it's been hotter here in St. Louis since you've arrived than it was in Orlando.
That has been shocking. Many days I look at the weather app and I see, oh my gosh, it's hotter here than Orlando, which is surprising.
Well, on the topic of St. Louis, you've been here for a few weeks now. What's been your favorite parts? What have you enjoyed seeing, and what do you want to see more of?
So it's not going to surprise anyone from St. Louis that I say this, but I've loved exploring all the different neighborhoods. I love neighborhoods with great shops and restaurants, and there are so many here to explore. One of the first things I did when I got here was go to the Soulard Market. Loved it. That whole area reminds me of New York and a little bit of Brooklyn. So I love to find a little slice of my roots in that part of St. Louis. And I look forward to exploring that area more and going back to that market as much as I can.
I love the Soulard Market growing up. They used to have banjo players that,
Really?
yep, we'd go up and as a kid, they'd like give you their banjo pick and you'd strum the chords with them and they'd sing. It was quite embarrassing as a 6-year-old, but it's a pretty cool concept. So now we've talked a little bit about St. Louis and your background and who you are. What excites you most about being the new leader of the BHC?
Yeah, so I wouldn't have gone to just any coalition. I love that St. Louis is a mid-sized city. Everyone works here and lives here, which is very different from New York. In New York, and obviously pre-COVID, people would come into Manhattan for work and then go home to New York, New Jersey, Connecticut, sometimes Pennsylvania, and people didn't really live where they worked. And I think because we all live here and work here, it means that we want to make healthcare better and life in general better because we're here and our families are here. I had a funny example that probably would never have happened in a place like New York. I was here 3 weeks. It was Saturday morning. I went to Straub's here in Clayton because I have a temporary apartment here in Clayton. Saturday morning, I'm in like cut off jean shorts. I'm at the deli counter and all of a sudden I hear Laurel and I'm thinking, I'm only here 3 weeks. Like who could possibly even know me? And I turn around. It's Dave Thompson from Mercy, one of our new board members from MHI, who also lives in the neighborhood, picking up some bagels, I think, for the family. And that is just a great example of what I'm saying about my excitement about being in St. Louis. Like we live here, we work here, and you're going to run into people, neighbors and others where you have a common goal of trying to make healthcare better in this community. And I just love that. I think we can have a big impact.
Well, I think that kind of alludes to our next section or, category of questions, if you will, focusing more on your vision and strategy for BHC. So how do you plan to build on the achievements and initiatives of your predecessor, Louise Probst?
Yeah. And as I just said, Kaylee, I wouldn't have gone to any coalition. And there are about 40 coalitions around the country. There are initiatives in place here at BHC that Louise and the staff have done that attracted me. First is the Pharmacy Coalition. I love that we have a product that we're offering to our members. Not only does it provide funding for BHC, but it's a huge value to our members. And I really love the model. We don't make money off the product itself. We charge our members a fee to be in the coalition. So the incentives are aligned in the ways I think that are really important. And so that was one thing that attracted me. And I see us building on that. The other initiative put in place by Louise and the team is the Midwest Health Initiative, or MHI that we affectionately call it, which is our multi-payer claims database. And it's our multi-stakeholder organization. It's collaborative. It's where all the stakeholders come together, providers, health plans, employers, and others. And we focus on provider accountability for both cost and quality. And that's a lot of the history of the work that I've done. So continuing to build on, that work at MHI is important. And then policy, as I've been meeting with some of the members, I've been learning that many of our members look to us to be on top of the legislation that impacts employers at the state and federal level. We will continue to be that advocate. So I think, in answer to your question, building on things that Louise and the team have done, those are probably 3 of the strong benefits of membership: the Pharmacy Coalition, our work with MHI, and our policy work. So I'm looking to expand, on these efforts as we think about what we can offer our members.
Thinking about what we offer for our members, you're meeting with members right now and you're getting to know them and you're having those introductory conversations. Can you share a little bit about what you're hearing and some of those themes?
Yeah. So, I've been asking them really I would say, two categories of questions. One is, what are your challenges? What are your pain points? What are your top conditions that your population is struggling with? And then, what do you look to BHC for, and what can we do for you? And, I've been finding that, as with probably most employers around the country, and we have a mix of members, national, global, local, cost continues to be an issue, and certainly affordability. Almost unanimously, when I ask about top conditions, cancer
Mhm.
is still is top of mind. A little more focus on mental health. So, and when I ask about what they like about BHC, those that are in the pharmacy coalition feel that provides a tremendous benefit to them, and we really act as an independent advocate for them, and they feel like they can look to us to make sure they're getting the best deal, that they understand what's happening in the PBM world, and really sort of have their back. And I loved hearing that. I think that's a huge value that we can provide to our members. We're doing it now with the PBM. There may be other things we can do that for, but a lot of real appreciation for what we do for them in pharmacy.
Yeah. And have those conversations sparked any ideas for new resources or additions to BHC program offerings?
Yes. So, I think there needs to be something here for everyone. As I said, we have national employers, global employers, as well as local ones. We've got City of St. Louis, we've got St. Louis Public Schools, the county. And I think one of the real values for the members of a coalition is the networking and the education. And I want to make sure we provide more opportunities for employers to come together, to share, to learn from each other. We want to bring back roundtables, in-person meetings that were so prevalent, before COVID. Kaylee, you and I are sitting in a big conference room we have in our offices at BHC. And I have learned that this place was buzzing, at one time with members and those kinds of opportunities. And so definitely looking to bring that back. I'm thinking about bringing together senior leaders to share with each other, as well as something for the up and comers, some of the more junior employees that could really benefit from hearing from the senior leaders and then their colleagues. But I also recognize we have members that aren't in the region. We have members nationally that access our pharmacy coalition, and I want to do more for them. So as much as we can think about virtual opportunities to bring them in to roundtables, to bring them into education, that's also going to be a big focus.
So, Laurel, moving forward in terms of collaboration and partnerships, with the local healthcare providers and community grassroots organizations and other business coalitions, how do you envision leveraging those relationships or developing new partnerships to support the coalition's goals?
Yeah, employers have the power to change healthcare. They can't do it alone. They're really there to drive. We have to collaborate with all the stakeholders. Certainly the providers delivering care to our employees and families. We do a lot of work through the Midwest Health Initiative to measure the quality of providers and look at cost, and on behalf of employers, work with them to improve the value of the healthcare services they're delivering. The health plans, our employers are contracting with health plans to deliver the benefit program. So making sure that we're partnering with the plans is also critically important. And then, community-based organizations. So I do want to understand in St. Louis, particularly in our region, how we can partner with organizations. For example, I think my first or second week here, I went to a breakfast with the Alzheimer's Association, right? And, we have a lot of people in the workforce that are caring for family members and others that have Alzheimer's. That affects productivity, it affects healthcare costs. I think we have an outreach from the Arthritis Foundation to meet with them. So I want to understand what organizations, community-based organizations are in the region that we can partner with, and eventually, bring bring value back to our employer members that they can use to improve the value of their benefit programs and really help their employees to be, most healthy and productive. So collaborations and partnerships are key. And that's why we're here, to facilitate those on behalf of employers.
And I think it goes back to the point that you brought up earlier, in that St. Louis is kind of talked about as the biggest little city, or I might be botching the execution of that, but everyone kind of knows everyone. And if we already are, around each other in our workplaces, we might as well be working together in our efforts and not reinventing the wheel. So I think that makes a lot of
Yep,
sense.
exactly.
I have just a couple more questions for you as we kind of wrap up. I want to know more about your vision for the future of BHC and MHI. Can you tell us a little bit more about that?
Yeah, and I think this is really kind of the big picture vision, Kaylee. My view, and I said this at the beginning, that the head of benefits is the most powerful position for the 60% of Americans that have employer-sponsored healthcare. They have the power to make healthcare better and more affordable. But that's a big task. They wake up every morning thinking, okay, how am I going to deliver health benefits to my thousands of employees today? We want them to wake up and say, how am I going to transform the health system with the leverage that I have? So we're there to really help them do that and educate them about their role. So the backdrop of what's happening in healthcare now for employers and really for everybody is that we have the ever increasing healthcare costs.
Yep.
But coupled with that, there's an increasing recognition that healthcare is becoming less affordable for employees. We're hearing more about medical debt. We're hearing about people avoiding care if they have high deductibles. On top of that, we still have challenges with quality, patient experience. We have an increasing prevalence of diseases that require more expensive medical and pharmaceutical solutions. The hot button at the moment are the GLP-1s, and that's only going to increase. We have regulatory challenges, compliance requirements, and the complexity of the employer role as a fiduciary under ERISA. And the fiduciary responsibility is not solely a financial one. Employers must focus on the overall value of the benefit they're providing, like short-term and long-term. So these are the kinds of things that I see us being able to help employers with, and ultimately the system. I really want BHC to empower employers to use their leverage to drive change and really support them. I want to bring innovation to the community and to the employers and introduce them to new things that employers are doing around the country that are really, focused on value-based care, primary care, affordability, and quality. And we need to dig into the cost drivers. And when I think about MHI and the data that we have the data to understand what are driving costs and what are some of the quality issues. So marrying that with our employers and the leverage that they have is ultimately going to help us drive change together, in this community. It's what BHC and MHI have been doing since the beginning. And we need all the stakeholders to come to the table to drive change. Employers have a lot of power. They can't do it alone. And, my goal is to build on the great work that we've already done for many, many years and make it more impactful for the future.
Well, I know that we're kind of wrapping up. Do you want to take this opportunity to maybe plug a couple of upcoming events that we have on our calendar?
I do. I'm excited that in September, on September 13th, the author Marty Makari is launching a new book called Blind Spots. And we are excited that he is going to stop by the BHC, not at our offices, but nearby, and tell us about that book. We'll have books for the attendees, and he'll be doing a signing. He has been a real thought leader in this country around quality and cost. He wrote the book Unaccountable, followed with The Price We Pay. He's a physician at Johns Hopkins. So very excited about that. And then we are bringing back the Wellbeing Roundtable. And this will be, one of our gatherings of folks that are focused on the well-being, wellness programs of our employers with just sharing what's working, what's not working, and we're excited about that. And I am working diligently on the agenda for our annual meeting on November 7th, so stay tuned for that. You're going to see the focus probably be on some of the things I talked about: innovation, employers driving change, and save that date, November 7th.
It's crazy to think about how close the annual meeting is already.
Yes.
Well, thank you again for sharing your time and thoughts with us, Laurel. It's clear that your experience and vision will bring tremendous value to our organization and to our member companies. And we're truly excited to see the impact of your leadership and the new ideas that you're bringing to the table for us and our members.
Great, Kaylee. I'm excited.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.